intersection of trust and truth. Because to UBC, your story, and every voice matters. UBC, inspiring Uganda.
Welcome to Good Morning Uganda, your go-to morning show to kickstart your day with all the latest updates.
Let's dive deep into issues that matter most to you.
In a world of stories waiting to be told, the headlines are your guide. Navigate the currents of news and knowledge with our daily updates of newspapers. Stay informed, stay empowered.
From the roar of the crowd to the thunder of victory, witness the drama unfold with our sports updates. Whether on the field or in the stands, join us as we celebrate the spirit of champions.
Rise with Good Morning Uganda, weekdays from 6:30 a.m.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukota Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
Pick of the day on UBC. Was brought to you by
I'll call you every day, yeah yo, baby dondolo.
You can now get all the Chibuzi out with MTN voice bundles. Call all networks, Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000 or buy any daily voice bundle of your choice. Dial *100 *21 hash and select daily or use the My MTN app. When we talk together, we are unstoppable.
Junko. Yo. Check the shopping, man. What's your secret?
Haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, it is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a poultry project, and now things are moving.
Junko, I thought I was one of your friends.
You are,
but you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Much thanks for being with us on UBC TV. Welcome to the Extra. I'm Robert Chirabo Nyonyintono. But just a quick one, we are always here from 6:30. So please make it a date with us every weekday from 6:30. That is when we kick it off with Good Morning Uganda. And then from 9, an extension, which is Good Morning Uganda Extra. Today, we are going to be discussing matters regarding health. And when we talk about health, well, we'll be discussing mpox or monkeypox. I'm sure you could have heard of this as a Ugandan and as a threat. Now, as we speak, we got our first case or registered our first case that was in July last year on the 18th, and that was in Kasese. 2 cases were registered then. And for Kampala, on the 19th of August, we registered the first case in Kampala. But this was someone who was coming in from Mayuge, fell sick here, and that's how we got our first case. Now today as we speak, Rubaga Division and Machindi say Kampala, things are not at their very best because figures seem to be growing every other day. And also there is an incident that some of the private players here, the private sector, could not have cooperated very well to ensure we end this, because government has a proper management system that when someone is detected, tested and proved it's monkeypox or mpox, then there is a proper treatment center. But some seem to be, I don't know, but the good thing is I have an expert with me, I have a medic with me, and that is Dr. Buruma Dennis, who is the District Medical Officer, Directorate of Health, Rubaga Division in Kampala. Now, he's here with me and we'll be knowing more of what government is doing, how big is this problem, but also what should we do and what exactly is mpox. Doctor, you're most welcome.
Thank you, Chirabo. Good morning, UBC viewers, and I'm happy to be here with you on this show.
Now, doctor, to begin with, when you talk about monkeypox or mpox, to our viewer, paint a picture. What disease is this? Yes.
So, mpox is the official name of this disease. Mpox is a viral illness. It is caused by a virus, and this virus is normally in wild animals like monkeys, squirrels, rats. However, it comes to human beings when a human being has contact with an infected wild animal. And once a human being gets it, then the human-to-human transmission begins. So it's the very first time Uganda is registering an outbreak of this disease. It's not one of the indigenous diseases we have in Uganda. We have never had it before. So it's a new disease, and many of Ugandans didn't know about it. And so we need to learn about it so that we know what to do and to avoid it. So it's a viral infection. It attacks you when you have contact with somebody who has the disease. So it is spread through various ways, but we are going to emphasize the most common way it is spreading in Kampala and in Kampala-Wakiso Mukono area. So it can spread through contact, like I've said. It's mainly a contagious illness. So if you touch somebody who has the infection, or if you touch something that person has touched, that something could be a phone, could be a door handle, could be his clothing, could be his bed sheet, could be anything he has touched. For as long as that person has an infection of that virus, then you get the virus too. And then it starts to multiply in your body, and it takes up to 21 days for you who has acquired the virus from another person to develop signs and symptoms depending on your immune system. So once you are infected and you show signs, then you become infectious. In other words, you can transmit to other people.
That is
so
after how many days for it to show signs?
Within
the incubation.
The incubation period is within 2 to 21 days. In that period, after you've gotten the virus, you will show signs and symptoms of this disease. And so once you show signs and symptoms, you become infectious. Other than just contact, the most serious route of transmission of this mpox infection is sexual. It is sexually transmitted as well. So if you have sex with somebody who is infected, you will get it. But also the unborn child of an infected pregnant woman can get the infection. And then, of course, the other way is if you touch or skin or eat or interact with an infected wild animal. So in this time, we are asking Ugandans, let's avoid eating wild game, because you do not know whether that animal that was killed had the virus or not. Let's also avoid, I know that in Kampala we don't have major forests around, but I know within some homes people have, artificial forests, and this attracts some monkeys. Let's avoid interacting with them and in as much as possible during this period. Because if that monkey interacted with a wild monkey elsewhere which has the virus, you will still contract the virus. But also we need to be alert to stay away from contact with people who may have signs and symptoms, which we are going to talk about. Yeah, so let's avoid contact. Let's avoid reckless, I'll call it a reckless sex. Because what is fueling the infection in Kampala and in Uganda specifically at this point is sex. Especially from the red districts.
I was told there is one lady of the night who spread to 40?
Yes. One.
Yes.
Yeah, we do follow up
that report.
Yes, we do.
40 men.
We do follow up how an infection, how one has transmitted and gotten the infection, and when we did that, we were able to trace that one sex worker in Kawempe was able to transmit up to 40 men. So it is that serious. So we need to be careful and avoid this infection.
So
it's very painful.
Abstain from sex workers.
Let's abstain from that business at this point. Yes, so what are the signs? The signs and symptoms of mpox. Mpox starts like any other illness. So you will have things like headache, you will have a fever, high-grade fever, you will have body aches, body pains, backache, you will have general body weakness. The whole body becomes weak, you can't do anything. Then you have sore throat. You may have sore throat and a dry cough. Then you may have painful swollen lymph nodes, Sanjaba, in the various regional places where they are. And then eventually you will have a rash. Now the rash, which is diagnostic, although we still need to take a sample to the laboratory to confirm, but once you have that rash, and the rash will not appear on the entire body at once. It comes as a single pustule on you somewhere on the body. It could be on the hand, on the face, on the body, on the legs, or on the private parts. Now, interestingly, the rash usually appears in the area of the body where the virus entered you. You get it?
Doctor.
Yes, sir.
So, if it was sexually...
It will be the sexual organs.
The sexual organs.
Yes. And it's a very painful thing.
Of course, if it is in that area.
So then it spreads.
Yes.
So yeah, if you delay to seek care, this rash then now spreads to the whole body. And it could even attack you in the mouth and in the alimentary canal. They attack at the mucous membranes. Some people come when they have wounds all over in the mouth due to this virus. So the rash is very painful, it's itchy, and so we ask Ugandans, once you have any of those signs, or you have seen somebody with any of those signs, and presents with a rash. The rash for mpox is very characteristic. It is not the usual rashes. I know that mpox resembles smallpox, but I know that smallpox doesn't exist. So many Ugandans may not have seen a patient with smallpox, but what they have seen is a patient with chicken pox. Now, chicken pox rash, it wants to look like mpox rash, but it's smaller. The rashes are smaller. The ones of mpox are big pustules. Yeah. So if you've seen a patient with the chicken pox, you may mistake the mpox for chicken pox. But for as long as that person has these symptoms I've mentioned, and then the rash comes in this current time, that person is most likely having mpox, and we need to confirm it. So we confirm it by taking a sample from one of the rashes, the pustules, to the laboratory, and once the laboratory tells us they have seen the virus, then we say you have mpox. Now, brothers and sisters, Ugandans, mpox is a foreign disease, a new disease. What does that mean? Not all health facilities have the technical capability to treat it. Yeah? When I was in medical school, I never studied about mpox because it didn't exist. So even though I am a doctor, I do not know how to treat mpox unless I have been trained afresh. What does that mean? And I'm speaking to our brothers in the private sector especially. When you receive a patient with the signs and symptoms we've mentioned that are suspicious of mpox, kindly call KCCA. There's a toll-free line we have put so that we direct and guide you how to handle this patient. The government has put treatment centers for mpox, just like we did for COVID, because it was also a new disease. Not all of us knew how to treat it. So for all new diseases, government has a program where they train specific health workers to handle and manage those patients, to treat them. So currently, there are treatment centers for mpox. For now, Kampala Wakiso Mukono has been using Entebbe Hospital. So all patients we confirm to have mpox, been referring them to Entebbe Hospital, and then you are treated under specialized hands, and then once you heal, you are integrated back in the community. The beauty is that the facility there is free. You are not charged, the treatment is free, the care is free, the feeding is free. Once you're okay, then you are released back home. And usually in the normal circumstances, between 2 to 4 weeks, you are healed. Depending on when you present. I've seen patients who present in 4 days and they are healed, cured and sent home. When you take longer, it takes longer because the body becomes weaker. Yeah. So we are calling out to all Ugandans. Once you see any of those signs I've mentioned, please present yourself to a nearest health facility. The reason you present to a nearest health facility is not for them to manage you, it's for them to check you and see if the disease you have is likely to be mpox, so that they call us. So once you are suspecting even yourself that you have mpox, present yourself to the nearest health facility or to your village health team member, the VHT, and then the VHTs have the toll-free number to call so that we guide you how to receive appropriate treatment.
Now, we are looking at matters of health and mpox awareness. Doctor, it is very important for our viewer to know how big is the problem. What are the current statistics?
Okay. Yeah, so like Mr. Chirabo said, mpox was discovered in Uganda in July last year, in Kasese, after 2 patients presented with malaria-like symptoms. But when they were put on treatment for malaria, they didn't improve. So this prompted health workers to think, what could it be? It wasn't a normal disease. So they took off a sample. And when they took it to Entebbe, where we checked for viral infections, it confirmed they had this strange virus. And the Minister of Health announced officially that Uganda has an outbreak on August 19th. August 19th, the first case in Kampala was registered. Since then, the number of cases has gone increasing, and the number of districts are affected has gone increasing. As we speak now, as of yesterday, in total, Uganda has registered 1,830 mpox cases.
1,830?
1,830 in 74 districts.
Oh.
So from one district, 2 districts, now we are in 74.
So the rash is similar to that?
The rash is similar to that. It comes as one pustule, then it spreads in the whole body if you take longer to seek care. And like we say, that single pustule could appear anywhere on your body where the virus actually entered into your body. It could be on the face, on the hand, on the thigh, on the private part, anywhere. So seek care quickly. So now, what is more interesting for the Kampala people living in the Kampala Wakiso Mukono area, is that out of these 1,830 cases, over over 1,178 cases are in the Kampala-Wakiso Mukono area. That's over 66.7% of the national figure. That means the disease is actually more in this area, Kampala-Wakiso Mukono. But again, Kampala-Wakiso Mukono, the 3 districts don't have the same share. The biggest problem is actually in Kampala. Now, why Kampala? Kampala is special in the sense that many of us work in Kampala and sleep the other side. So the interactions within Kampala are so huge. There's a lot of human traffic in Kampala. The activities we do are so many. The mode of transport we use, you know it. So the human-to-human interactions are so much within the city that it is also easier for a disease like this to transmit once the community is not alert. But 2, we know for a fact that Kampala has many of the red districts. Yeah, places where people sell sex. And this is what is fueling this spread in Kampala. So of the 1,178 cases in the Kampala metropolitan area, over 700 cases are in Kampala alone. You know, so Kampala alone is contributing to over 44% of the national cases. Kampala alone. And we know that Kampala has 5 divisions. Again, out of the 5 divisions, we do not have the disease spread out the same way. So this disease has ravaged more of Kawempe division.
And that is one of the key areas where that business is
yes.
lucrative.
So in Kawempe, the 2 seriously affected parishes is Kawempe, Bwaise 1 and Bwaise 2. Those areas are highly contributing to the national figures. So for the Kampala figure, of the over 700 cases in Kampala, close to 400 are in Kawempe alone. Then the other divisions share out the other numbers. In Rubaga, we have 99. In Makindye, they have 163. In Central, they have 54. And in Nakawa, they have 67 cases.
Oh, Nakawa is doing less?
That is as of yesterday. But we are registering new cases every day on an average of at least 10. Now, that is worrying. And since the outbreak occurred, there is no single day we have not registered a case in Kampala. So it's becoming very difficult to contain this situation if Ugandans don't raise the occasion to actually prevent the transmission. The transmission routes, we have said them, contact, and especially sexual contact, but also contact through touch and touching items that the infected person has touched or used. So if we can practice things like avoid sex with outsiders, people who are not your if you are married, you have a partner.
To be very clear, doctor, these are matters of health.
These are matters of health.
Let's call a spade a spade.
If you are married, do zero grazing. Do not buy sex on the street. That is what is fueling the transmission in Kampala.
These girls that stand in that wherever those red districts, shun them for now.
Avoid them. Avoid them. They are danger. Other than HIV, you will acquire Mpox and other STD, sexually transmitted infections that we know.
Maybe one would ask, doctor, how can I phrase it? Okay, you've just talked, if they are sexually transmitted, many may think if they use protection,
they are safe.
They are safe. It is about contact. So also clarify on that.
Okay.
Someone will say, no, if someone is using protection,
they are safe.
They are safe.
Thank you for that question, and many get it wrong there. Now, for Mpox, there is no safe sex. No. Why? Because even when you put a condom on, the only parts that you are protecting are what? The sexual organ.
Yes.
They still touch. The body still is touching.
There is that contact. The friction and all that.
The contact between your body and her body is enough for you to get. So there is nothing like you having safe sex when you are talking of Mpox. We talk of safe sex if you're talking of HIV, if you're talking of other sexually transmitted infections.
Yes.
But when it comes to mpox, there is no safe sex. So the safest sex is to avoid sex outside marriage in this period. But also let's practice hand washing. The frequent hand washing of our hands with soap and water has proven to still be the most effective way of preventing not only mpox, but many other diseases that we usually get into contact with. So wash your hands frequently. If you do not, for us who work, you may not be in charge of hand washing stations wherever you move. Please move with a sanitizer. There are these small bottles. Buy it and put it in your pocket. For the ladies, put it in your bag. Every time, please sanitize. Wherever you've been, sanitize. It is very safe because you want to know where you have touched, the door you've touched, the table you touched, the whatever you touched, who touched it. So when you sanitize, in case there was any virus there, you kill it before you touch yourself. So hand washing, and would like to advise all those who run public places and public offices, let's put back our hand washing facilities at the gates. I'm happy I saw one when I entered. The only disappointment, I didn't see the askari enforcing the washing, but the hand washing facility is there. Let people actually wash hands or use a sanitizer at entry. It keeps you, the workers, safe, but also keeps the visitors safe from getting the infection.
Well, we are discussing mpox. We first registered our outbreak, that was last year in July, but for Kampala it was in August on the 19th. Now, this is a danger that is with us, and we must ensure that we reduce and where possible totally eliminate mpox out of Uganda, because today government is doing some work. But remember, if the cases are so many, the systems may end up being overpowered by the numbers. So what government is calling upon is for us to be aware of the disease and how best we can prevent it so that the systems are not overpowered. If you remember when we had COVID-19, there was a time when oxygen, much as we've always had these tanks, these cans are available, it was so scarce because everybody almost needed it. The intensive care units for every hospital, government, private, were all filled to capacity, because so we must avoid that situation. That's why Dr. Dennis is with us here to ensure that you are aware of this disease and how best we can avoid it. The good thing, we know how it's transmitted. We know what causes it. We know what we can do to avoid the disease. Now, Doctor, so far, what is government doing? What are the plans to arrest the situation before it goes out of hand?
So that's also a good question. What is government doing and what have we done? So immediately this outbreak was declared as an outbreak in August. Government and KCCA and the Ministry of Health set out what we call activated the task forces and the incident management teams. These are technical teams that are trained to be able to respond to an outbreak. So there are meetings that occur both at the national level and also within the divisions and the districts that are affected. These meetings are meant to actually coordinate the response, but also reached out. We wrote response plans and reached out to partners to mobilize resources. So far, we are thankful that some partners came on board and have been able to train. We've been able to retrain our teams. We've been able to set up a treatment units. And as I talk now, because of the number of cases increasing, Mukono now is having its own treatment unit. People from Mukono will no longer be taken to Entebbe. Wakiso has a treatment unit. And even in Kampala, we are going to set up a treatment unit in Mulago, so that because Entebbe is getting overwhelmed, so that we're able to manage the cases here. But two, we've set out, we have engaged the communities through community gatekeepers. The LOCs, the leaders, we have sensitized our leaders, the LOCs, the VHTs, the political leaders, councillors, and all other leaders at various levels, the religious, cultural leaders are all on board. This disease cannot be prevented by us medics alone. We need everybody's effort. Why? If a pastor can include a message on this disease in his sermon or her sermon on a Sunday, on a Friday, if the sheikh can talk about mpox on a Friday during Juma prayers, if a father can talk about mpox during Mass, it makes a whole difference. I will not be in every church, in every place of worship to talk about it. So we've engaged them, we have sensitized them and oriented them and given them talking points. Now we need everybody to do their part, because as a religious leader, you will not be happy if your worshippers are sick. Because when they are sick, they are not productive, but they will also not come to church. So we need people alive. So let everybody get out and get these messages out. We are having task forces meeting in all the divisions. We have activated the parish task forces to lower the coordination at that level, but also encourage communities to use these structures to report cases. Kampala has what we call an emergency center, call-in center. So we activated it. So when there is a suspect or an alert, what we call in our technical terms an alert, somebody who is having signs and symptoms who you suspect to have mpox, we ask that you call. When you call, that phone is attended to at the call center, and then a rapid response is initiated depending on where the caller is. So they send out to this, if the person is in Rubaga, to the Rubaga technical team. Please respond, there's somebody here who needs maybe a sample to be taken off, or who is sick here, and we attend to them. But two, we have tried to give out, to pin up posters or with key information on mpox in most of the public places. Please read the information we put there. I know most of the mass media has messages running on mpox and announcements. Listen to these things and take them in. We have tried to sensitize so that everybody gets to hear the message. Now, when you hear the message, please do not leave it there. If you see anybody in your community, at a place of work, or wherever you walk, in a taxi, market, wherever, with the signs we've talked about, get concerned. Why? Because you may not know this person, but because they're in a public place, if you leave them unattended, even you or your daughter or your son will get the infection from this person unknowingly. So it's a concerted effort that we call upon all Ugandans to get in, and then we'll be able to manage.
Yes, all Ugandans join the fight to ensure that we can end mpox in Uganda. Allow me to go for a very short break. When we return, still we will be focusing on mpox and seeing more, how do communities, how do individuals, and if there is any gap that we feel authorities have not done much to end this. We return shortly.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels, and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukoto Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
Juko.
Yo.
Check the shopping, man. What's your secret?
Uganda wange, haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. But what you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
The Ministry of Health informs the general public that there are some cases of Mpox detected in Uganda. The ministry, working with partners and affected district local governments, are doing their best to contain the situation. The signs and symptoms of Mpox are body rash, fever, general body weakness, headache, sore throat, nasal congestion or cough, and swollen lymph nodes. You can prevent yourself from getting infected with Mpox by avoiding close contact with people who have been confirmed to have Mpox or who have signs and symptoms of Mpox. Avoiding touching or sharing personal items like beddings, eating utensils, phones, or other belongings of a person who has the signs and symptoms of Mpox. Avoiding contact, including eating, with all wild animals, alive or dead, especially those known to carry the virus, such as rodents and monkeys, and those that appear sick or have been found dead. Getting vaccinated if you're among those who have been identified to be at high risk of Mpox infection. Mpox is treatable and usually goes away after 2 to 4 weeks. However, it can be severe, causing even death, especially among children, pregnant women, and those with other health conditions. For more information and support, contact your nearest health worker. Call the Ministry of Health's toll-free line on 0800 100 066 or send a free SMS to YouReport on 8500.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
You're still watching the Extra on UBC TV. Robert Chirabo Nyonyitono, and I have Dr. Dennis Mike Wolma, who happens to be the District Medical Officer Rubaga under the Directorate of Health. We are discussing issues regarding Mpox and how, for the first time, we have an outbreak, and the statistics, or call them records, are not in our favor because it seems the disease is just increasing day by day, more cases, and now also we have lost lives. We have lost about 10 people who have succumbed to Mpox. Now that means this is something you should take very, very serious as a person watching us. More so you people in Kampala, because when you look at the percentage of the entire records regarding the cases, and Kampala taking the lion's share, if I may use that word, doesn't sound very good. Now, doctor, many of these diseases, there is vaccine, then there is vaccination. For Uganda's case, are we anywhere closer to vaccines or vaccination?
Thank you for that question, Robert. Maybe before I talk about vaccination, let me highlight this. Other than the 1,830 people we have told you have been confirmed with Mpox, we also have what we call contacts. Now, contacts are people who have been in close association with person confirmed to have the disease. So once we confirm that you have Mpox, we come and ask you who did you stay with or work with or was in contact with in the last 21 days. Now, they may not have any signs and symptoms. Now, the reason we want to know those people is that these people have a higher risk of also getting infected because they were in close contact with you. So we line list them and are supposed to follow them up daily for 21 days to see if they develop signs and symptoms. And if they do, then we take off sample quickly before the virus overwhelms them and they receive treatment. But also they avoid further spreading the infection. So in Kampala metropolitan area, Kampala, Wakiso, Mukono, of the 1,178 confirmed cases, we have recorded over 5,500 contacts. People who have been in close association with those confirmed to have the disease. And these are followed up daily by our teams. Now, interesting also, of the 5,500 contacts in the KMA area, over 3,666 of these are in Kampala alone. You see. So that just highlights the burden that Kampala has and is contributing to the overall national burden. So all these 3,666 are Kampala people who we are working with, are in the markets, are in the taxi parks, are everywhere where you live. They have been in contact with somebody with Mpox, and they are highly at risk of developing Mpox. Once they show signs, they will infect others. So we need to follow them up. So what does this mean? If you have been confirmed to have Mpox, kindly cooperate with us when we ask you who have you been in touch with in the last 21 days. And the reason that's important, some of our colleagues, after they are confirmed Mpox, they do not want to declare their contacts. Now that is also spreading the infection. Because if we do not know who that was, who you were in contact with, we can't follow them up. They will develop the signs they will not even know. Yet we would have sensitized them to be on the lookout. The moment I receive a headache or a fever, it's likely, so I avoid other people. Yes. You understand? So they are out there in the community, they have been in contact with infected people, and they are getting sick, they are also infecting others. So let's cooperate in there. Back to your question. But
even before, there's something you mentioned. Sorry, it came along the discussion. Don't we have, because during COVID-19, you had those recorded asymptomatics. People who would have the virus.
But don't show.
But don't show, yet they are spreading.
So for this particular virus, you only spread when you are when you have the symptoms, is when you become infectious. So once you show symptoms, you can then infect others. Now, back to the question of is there a vaccine? So yes, there is a vaccine globally, because this disease is not only in Uganda, by the way. It's in several countries, both in Africa and also now in Europe and Americas. But so because it's been in other countries, a vaccine was developed much earlier. So there's been a vaccine for Mpox and it exists. Does Uganda have that vaccine yet? No. Are there plans to have the vaccine? Yes. However, the vaccine is an expensive thing and the country is not able to procure the required quantities of vaccines to protect everybody. So what are we saying? We are going to get some few doses of the vaccine sometime soon, around about March, right? When those vaccines come, they will not be for everybody. No. So we are going to consider those at greatest risk of getting Mpox in the high burden districts or places. And these are health workers, our sisters who sell sex, and some of their customers who we have already mapped. So the vaccine will be just for a few people because it's quite expensive for us. Now what are we saying? A vaccine will protect, but alone it will not work. We want you to take the preventive measures we are saying now more seriously, so that we don't get to a point where the whole country needs a vaccine. We don't have that money as a country to start having a whole country vaccinated like we had for COVID. Let's not go there. It is expensive. It will disrupt business and the economy. So we don't want to go there. But there will be a vaccine soon, in Uganda.
Well, before the vaccine comes, and actually the vaccine, being vaccinated against a disease does not mean you will not acquire that disease. So we can't say, let's wait so much. You still acquire the disease, but what will happen is your body, the immune system, will have built resistance. And you will have these symptoms, but not deteriorate. Simply like we have a measles vaccine. A child who has been vaccinated with measles will have the red eyes, the rash, some bit of temperature, but plain and normal, live normal. But one who wasn't vaccinated, it's more or less a death sentence to them. So as we wait for the vaccines, which will only go for the few, like the doctor has said, better prevention than waiting for cure. Because the good thing is, Mpox is treatable, but that does not guarantee you that will not be among the 10 to add on the figure of those that dead to be counted in our statistics. Doctor, now having given us that broad picture of what it is, how it spread, the treatment chain, you've not mentioned, we've not seen government moving in to put some stop gaps. We are also relying on thinking that yes, Ugandans will buy this information. Those that are going to the red districts will desist, contact. You know, we've not seen maybe enforcement of hand washing in public places. We've not seen enforcement, say some places where usually I know it is almost inevitable to avoid this body contact. Talk of these brothels, the lodges, where I know that in some places in Kampala, Rubaga division, where you're coming from, doctor, almost where there is, they call them lodges, they will find women around and that there are rooms, our sisters have rooms, so men are bypassing Jangu, enter here. So we've not seen regulations or serious enforcement to deter, because believe you, some men, even with this, may still be tempted on their way home or where to branch in for some moment of happiness. Believe you me, public places, just telling them put washing, they may not do this. We must have that bit of enforcement. Why not? Is it still too early?
Thank you, Robert. It's not too early. So what we've done, you know, human behavior is funny. So what we've done, before we strike the whip, we've tried to put the carrot, right? So we have engaged all these places physically. We have our teams that go there to actually health educate them, tell them about the disease, how it's transmitted, the dangers, and how to stay safe. Even in those places, you know, you're talking about the red districts, we are there. Our teams are there, are talking to these sisters of ours, are talking to the managers of those places, how to stay safe and how to keep the places safe and to keep their customers safe. Now, we are also in localized ways enforcing. However, we do not want to reach a situation. I know in COVID, and you would see this on TV, a person is walking with a face mask until he reaches a police, you know, stop, and he's told the Tolina mask najijayu. I mean, let's be serious. Is the mask for you? Is it for the security? Ugandans, let's use our brains. This disease, once it attacks you, it is you who will be affected. The only challenge is that you will become a burden to the community because you will infect others. But let's take the message. We do not want to come to your bedroom and whip you. Now, please, if you have the infection, present yourself to the health center. We are emphasizing, and let's work together. All managers of public places, public offices, you want your employees safe, I'm sure. You want your customers safe. You want yourself safe. Please adhere to these preventive measures we are saying. Reactivate the hand washing facilities, reactivate the sanitizers at entry points if you cannot use hand washing. I know that for some places hand washing may be inconveniencing the time, the what, but the hand sanitizer at the entry is quite an easy thing to do. And now sanitizer is not as expensive as it used to be during COVID. Buy sanitizers, put them at places of entry, and let's be on the alert. If you see anybody with signs, fever, headache, is not responding, has a rash, please call the KCCA toll-free line so that we guide you on how to respond to this case. And also our brothers and sisters in private clinics, in hospitals, if you receive any patient suspicious of having Mpox, do not hold on to them, do not treat them. Please call KCCA toll-free line so that we guide you on where this patient can receive specialized care. Mpox is not treated the same way you are used to treating the ordinary rashes, but it's also very infectious. The patients need specialized treatment.
These assumptions of it is chickenpox for adults. There is one health center telling a patient, no, this is onamusuna wabakuru tujja mujjanjaba until the patient deteriorated to the last. So please, this is, like the doctor said, leave that money. Don't want that money also. Just let government take over and doctor confirm to the public that this Mpox treatment, is it totally free?
So the treatment for Mpox is completely free. Government is providing that treatment. In all treatment centers that government has put up, treatment is free. And there is no cost you incur. So we encourage people, once you suspect, even the testing itself is free. Now, for our colleagues who manage health facilities, please, if somebody presents with those signs, even when you think it is the normal namusuna or chickenpox, yes, because we have an outbreak, we kindly request you to still call us so that we take a sample and let the laboratory tell us it is not Mpox. It is safer that way than playing with this person you're treating them for chickenpox, when actually it is Mpox and they will deteriorate and die. Yet we could have confirmed and they receive better treatment. So let's all play our part, and we can actually prevent and end this disease.
Well, Doctor, I must thank you for your time, and above all, our viewer for being with us all the way from 6:30 till now, and the extension, which is Good Morning Uganda. We've been discussing Mpox, the outbreak that we have. The numbers seem to be increasing, and it takes you, it takes me, it takes the community, it takes everybody to ensure that we end Mpox. These statistics are not good at all, and we don't want to reach a situation where it is out of hand and government has to involve tough measures like we remember during COVID-19. Doctor, before I let you out of our studios, can I just have your parting shot?
So as we end this show, Kampala people, I want to tell you that we need to work. The new year has begun. I know you all have goals. The term is beginning in a few weeks. For those who are parents, you know you need to pay fees. This is not a time to fall sick. This is a time to make money. You will not make money if you get Mpox. Stay safe. Avoid buying sex on the streets. If you see any suspicious signs, report or call our toll-free line. And I'm going to read the toll-free line for the public to know that you can call for assistance if you see or have signs of Mpox. But also, let's wash our hands as often as possible to avert this disease. So the KCCA toll-free line to call is 0800-299-9000. I repeat, 0800, that is 0800 299 000. So you call that line, you will receive guidance on what to do.
Well, thank you so much, Dr. Buruma Dennis Mike, who happens to be the District Medical Officer, Lubaga Division, Directorate of Health. Thank you so much for your time.
Thank you, Robert, for the interaction.
Yes, and of course, that very important information for our public to keep healthy. Like he has said, it's not time to fall sick. It's also important that you report, let me use the word report. Report any person you suspect on those toll-free numbers, because sometimes people are hesitant and many have all sorts of stories. But remember, as long as that person is within the community, they are spreading the disease. It may catch up with you or any of your loved ones. So let's inform KCCA, let's inform Ministry of Health of any suspicious person to be carrying out or to be having this disease. And for the men, for the ladies, let's ensure we are very responsible when it comes to issues of sex. Because one sex worker in Kampala, that is in Kawempe, transmitted the disease to 40 men. This is evidence, it is recorded. So remember, as you mess around, one of the things you could come with, which has no any form of protection against it, that is Mpox. Have a lovely day. May the good Lord bless you. See you tomorrow. Heaven's wishing. Have a blessed day.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Pick of the day on UBC.